we focus so much on the horse during the breeding season that oftentimes they get forgotten about the rest of the year. But that rest of the year can be really important to set up our success for the next year.
Hello, hello, hello. Welcome back to Vetfolio Voice. I'm really excited you joined us for this one. This episode is sponsored by DECRA and features Dr. Ryan Ferris. And we finally have another equine episode. I love it when we get the chance to talk about species outside of dogs and cats and just small animal medicine in general. I mean, these days I feel farther and further removed from the large animal side of veterinary medicine, evidenced in this talk by me forgetting the word float when we were talking about equine dental care. So really, I always appreciate the opportunity to get to step back into it a little bit. I always learn a lot. I have so much fun with these conversations. This was certainly no exception. Like I said, in this episode, I was joined by Dr. Ryan Ferris, and at first, we thought we would be talking mainly about breeding considerations and talking about broodmares from that perspective, but as the conversation evolved, it ended up being much broader, and we really got into year-round husbandry and keeping these mares healthy outside of breeding. We got into topics like vaccination, deworming, nutrition, body condition, and how all of these pieces fit together to support long-term reproductive success and also just overall health. Ryan was an amazing guest. This turned out to be a great discussion. I really enjoyed it. I hope you do too. And I'm looking forward to adding more conversations like this one, exploring equine medicine, food animal, you name it, all of the species we care for in veterinary medicine. So let me tell you a little bit more about my guest, and we will get into our discussion on equine husbandry. Dr. Ferris graduated from Washington State University, completed an internship at Equine Medical Center of Ocala, and a residency in equine reproduction at Colorado State University. Dr. Ferris was an assistant professor at Colorado State until 2018 when he moved to Oregon and established Summit Equine. He currently offers advanced reproductive services to the Northwest with interests in embryo transfer and assisted reproduction. All right, let's get into it.
Nutrition is the cornerstone of our patients' health and happiness. The veterinary healthcare team should be the ultimate source for top-notch pet nutrition info. When clients see how the right diet helps their pets stay healthy and happy, they visit us more often. Remember, good nutrition is essential. It's smart business and great medicine. Enroll in the NAVC Pet Nutrition Coach certification today on vetfolio.com.
Dr. Ryan Ferris, thank you so much for joining me for this episode. I don't get to talk about equine medicine enough, so I'm really excited to get into this talk because we're gonna speak a little bit more generally about broodmare management. So I'm excited. Thanks for being here.
Yeah, thank you very much for having me. It's one of those things as a reproductive specialist that we focus so much on the horse during the breeding season that oftentimes they get forgotten about the rest of the year. But that rest of the year can be really important to set up our success for the next year. And so I think it's crucial to think about these horses year round and set ourselves up for having an easier breeding season in 2026.
Yeah, absolutely. And as a matter of fact, when I first got the topic, I really thought that was what we were going to talk about was the mare during the breeding season and how we were managing her and everything. So yeah, I was excited to find out, no, we're going to talk about holistically managing this mare, holistically with a W. So let's start with nutrition. I know that's hugely important, to every living thing, but certainly when we're talking about brood mares. So how do we think about nutrition for brood mares just throughout the year?
Yeah, I'm going to start with one area that is oftentimes forgotten about because when we think about nutrition for brood mares, we focus on the pregnant mare, right? She's carrying that legacy for that client for the future, right? So everybody's so focused on, is she well cared for? Is she fed optimally? Is that fetus getting all the nutrients it needs for success? And sometimes we forget about the open mares or the barren mares that are just left alone for those 6 months, but that nutrition is extremely important as well. And I think it comes around with setting ourselves up for success. And so before we really talk about specifics, maybe talk about some of the issues we face with nutrition. Obesity is an issue in our brood mares, right? And I think that carries over in a couple different ways. One, these horses used to be performance athletes. And so, with that, they're on a high forage, high concentrate type of diet. They're working a lot, they're burning a lot of calories. So, of course, they need to consume a lot of calories. And then, when those horses move to being brood mares, oftentimes their athletic expenditure drops significantly. And so, they don't need all of those extra calories and they start to gain weight. And it's always debated a little bit in the horse. How does body condition score affect reproductive outcome? There's a couple different studies out there, and they go back and forth of do they affect outcome? Do they not affect outcome? But especially when we look at all of our other species, human, cattle, other domestic species, obesity dramatically affects reproductive success. And I think in my own clinical program, I can say quite readily that horses that come in that are obese, they struggle to become pregnant or to donate embryos. And as we look at those mares, I mean, I'm not an internal medicine specialist, but we're oftentimes looking at those horses for PPID or insulin resistance and those types of things, and trying to make changes in February at the start of the breeding season. But boy, it would have been lovely if those changes had been made in October, like now, so that way we were set up and maybe that mare had an opportunity to lose 100 pounds of weight moving into the breeding season. So I think that's one of the major things that we're seeing is obesity. Again, one, it comes from the performance horse, but the other thing that happens with these horses is rightfully so. They're managed very strictly from February to July, roughly, and then oftentimes they're turned out on pasture, which is great for the horses, right? They love it. They love being out and moving and all those types of things. But boy, some of these pastures can be pretty rich, and these horses can gain a fair amount of weight in those couple months that they're just out on pasture. So I think looking at these horses a little bit more strategically and coming up with game plans, we try to do that with a lot of our fall checks of just touching base with clients of what are you feeding this horse currently? What is its actual needs and demands and those types of things. And as we think about that, so now that we know that obesity is a problem in our broodmare, and I think the underlying principle for that is obesity as an inflammatory state.
Right. That's what I was going to ask you is like, does it have to do with the pro-inflammatory properties of adipose tissue?
Exactly. Yeah. So it's a pro-inflammatory state. And so when we think about that, for being reproductively successful, those oocytes are growing up in that inflammatory state. Conception and early embryo development is happening in that inflammatory state. And so we're trying to monitor that and reduce that inflammation. And so if we can naturally do that, that saves a lot of medical work on our end also during the breeding season, right? So let's make this all easier for everyone.
Yeah, I think there's a lot of factors there that, certainly weren't top of mind for me. I'm in the Southeast, so admittedly, I've been in small animals since I graduated, but putting a mare out on pasture and having her become obese from being out on pasture just does not seem like a common thing that happens here in the Southeast. So, certainly if you took somebody like me and I was in an area where there were those rich pastures, I mean, that would be a whole new consideration. So it sounds like there's probably a lot of geographic variance.
Absolutely, there is, right? I mean, I'm up here in the Pacific Northwest, and we are fortunate to be very forage rich. So our grass hays and alfalfa hays are very rich, almost to the point where you don't have to feed any concentrate or grains to our horses. And even then, sometimes we struggle with obesity in that population. Versus, yeah, down in the Southeast United States, when I was down in Florida, the grass hay is nowhere near the same quality, and so you're going to have to add some concentrates. So for everybody listening to this, I think trying to figure out what your regional balances are is huge, and you can't just take, well, the guys in Texas do this, or the clinics in Florida do that, or I saw this great posting from this group in Michigan and that's how they're feeding horses. Well, that probably doesn't apply to your nutritional value for you and your specific region. And so really getting that insight in what you need there is crucial. And really it comes into calories in and calories out for a lot of these things, right? So you got to think about what these horses are actually doing on a day-to-day basis. And especially if we want them to lose weight, we not only need to back down their nutrition, but also increase their exercise. Sometimes that's as simple as just putting a saddle on them again and going for some nice, easy exercise. Or a lot of facilities have brood mares and performance horses and have a panel walker that they can put these horses on. I think it's great to get them out and get them moving because we all put them out in turnout, if you will, for exercise. And I kind of jokingly tell my clients that, well, that's why the treadmill spins at the gym. Because if I just go stand on it, I'm probably not going to hit the go button, but somebody's going to walk by and hit go and make me walk. Same thing with turnout. If you just turn the horse out there, they run and jump for about 3 minutes and then stand for the next 4 hours. And so getting a little exercise into our patients is always a good thing, just like ourselves.
Yeah, it's like when I put my dogs out in the backyard and then they just lay on my back porch and stare at me. And I'm like, that was not the intention here.
That was exactly, yes. Yes, they run around for 3 minutes and then just stare at you through the back door.
Pretty much.
Exactly.
Yes, like this is not what you're supposed to be doing right now.
Our horses do exactly the same thing, right? I mean, and fair enough, right? Like we don't oftentimes do any different, right? So why would
Yeah.
they? I think one thing also to think about regionally as you go through a lot of this is some tidbits that I've learned along the way with nutrition that are kind of interesting and whatnot is so up here in the Pacific Northwest, our forages are really good. And when I first started, when we moved here in 2018 and started working in the area, what I saw was a lot of people would feed alfalfa or grass based diet, and that met most their nutritional needs. And then for their vitamins and mineral component, they would only give like a pound or 2 pounds of grain. But what you really need to be careful of with that is that every grain formulation is set with a minimum feeding rate per day. So common rates are 1 pound, 6 pounds, or 8 pounds per day. So if you picked an 8 pound per day feed as your base diet, but you're only feeding 2 pounds per day, that means that horse is only getting 25% of its vitamins and minerals potentially per day. So a lot of the feed companies have come up with things called ration balancers, which are really designed for like a heavy forage based diet. So you only feed them a pound a day, but it's really just giving them their base vitamins and minerals. And then if you need just a few extra calories, you can add in a pound of something else or 2 pounds of something else to make sure all your vitamins and mineral needs are met. So I think that can really help a lot of our patients as well, is just making sure that we're meeting not only the protein and energy requirements, but also their vitamins and mineral requirements as well. Because while depending on where you are in the world, you may be lucky enough to have access to green grass, which gets us a lot of our vitamin and mineral needs. Some of our dry hays are going to be deficient in some of those areas, especially depending on how long ago it was harvested. The longer from harvest to feeding, we're going to start seeing a drop off in a lot of our vitamins and minerals, and especially our vitamins in that dry hay. So you're going to probably need some sort of supplemental vitamin and mineral offering to these horses.
Yeah, it sounds like with these ration balancers, it's kind of offering more options so you can really adapt to the environment you're in. And if you do have these really rich forages that you don't have to feed 8 pounds of concentrate on top of that, still meet their needs without adding in as many extra calories.
Exactly. And also remember with nutrition, it's not one size fits all, right? We all know that person that can go to McDonald's every day and still not gain a pound.
I hate that
And I
guy. I'm
feel,
just
yeah, I
kidding.
hate that. I agree with you, right? I think about McDonald's and I gain 2 pounds, right?
Right.
I mean, so remember, it's not one size fit all, but, oftentimes we hear from clients like, well, but I don't want 8 rations for my facility, right? But can we kind of group our horses together, right? The easy keeper group, get those 4 horses on one diet, and the horses that need a little more support, get them on one diet. So instead of having 8 rations, we just have 2. And that way we have a much more balanced program for overall success.
Yes, you deal with some of the same conversations that we have on the small animal side of, oh, I have multiple pets and so I can't, feed the different diets. And it's, how do you navigate that? Because you're absolutely right. It's not one size fits all. Of course, it's a little higher stakes when we're talking sometimes about brood mares. I have been involved in some of those management cases. Yeah, it's intense. And so obviously being very careful with nutrition for these different horses and trying to meet the needs of the farm and the horses. Continuing down the line of nutrition, I think you hit a lot of really important points of making sure that we're managing nutrition throughout the entire year. How does it change when this mare becomes pregnant?
Yeah, great question. So, really, it doesn't change a whole lot initially, right? So, an early developing fetus is quite small. So, its actual demands on the mare are minimal. So, I have a lot of clients who like to, you do the initial preg check at 14 days post ovulation, and she's pregnant, and everybody's celebrating. And then it gets a heartbeat at 25, 30 days, and everything looks good. And then they instantly want to dump all this feed to this horse because, oh, she's pregnant, she needs all these extra calories. And in reality, at 25, 35 days, that little embryo is the size of a lima bean. So it's quite small. It doesn't require hardly any extra caloric intake from this mare. So really through about 5 months in full, the caloric demand to the mare is relatively low. And really it's about just making sure that their vitamins and mineral needs are met. And then from 5 months on, we're going to see an increase in protein requirements. So depending on where you are, that may up here in the Northwest, oftentimes we just add a little alfalfa feed in alfalfa hay into our diet to meet those protein requirements versus in Florida, last time I was down there, alfalfa hay is quite expensive. So that
Yes.
may not be the best option. And we may reach for more of a grain type feed to offer that increase in protein to that broodmare. So it's a little bit of a dynamic thing depending on where you are regionally. But overall, we want to see an increase in protein from about 5 months through term. And, I think the biggest thing is not getting these mares obese prior to going into foaling. It's my clinical opinion. I don't have data to support this, but the mares who come in with a nice body condition are 5 of 6. The whole foaling process is so smooth and easy. The mares that are coming in with body condition scores of 8 or 9, it just never is as easy of a process. Even though everything may go normally, it's just not easy.
I'm glad that you brought that up because that was another question I had when we were talking initially was, you said does it have an impact on outcomes? And I was wondering if when you say outcomes, are we talking about the success of being able to get these horses pregnant or to deliver a live foal or both? And it sounds like you said it does affect your ability to get her pregnant, but maybe also to safely deliver a live foal.
Yeah, or just make it easier for everyone, right?
Right.
Like it kind of goes both ways. And so, for these pregnant mares, I mean, that's really the requirements that they're going to need through their gestation is just a little extra protein and a few extra calories later in gestation. The majority of the fetal growth isn't going to happen for the last 90 days. So that's really a big time. And things that people should look out for is your vitamins and minerals, especially in these pregnant mares. Calcium phosphorus ratios, trying to prevent developmental disorders, especially in the joints, OCD issues, those types of things. Really watching how you feed your horses is key, especially with in regards to minerals and vitamins to these horses. And for larger facilities that are going to buy hay for the year, I strongly encourage them to have that hay tested. It's a relatively easy thing to do. And what that hay test allows you to do is to better understand what are the nutrients actually in that hay that you're feeding, how many of them are bioavailable, and then actually be able to adjust your diet and ration to make sure that you're meeting that horse's needs. And especially with calcium and phosphorus ratios, that's really the key one that has been well documented to affect developmental disorders in utero and foals. And so sometimes with hay, it could be neighboring fields and phosphorus levels can change 2, 3 fold between fields. And so being cognizant of that is really key. And I know there's probably a lot of veterinarians potentially on this call going, oh God, he's talking about calcium phosphorus ratios, and this is going to involve a calculation and all of that. And I will flat tell you, I don't do those calculations either. I have great relationships with many of the local feed companies, and we rely on them. So if a client comes in and goes, hey, Ryan, I have my hay test. Can you help me calculate this? I go, no, but I can help you get the answer to that, right? And so typically we ask what brand of feed do you typically feed, and then we work with that company's nutritionist to actually look at this hay test and what they currently feed and see what adjustments need to be made. So I'm not the one sitting there trying to calculate out those ratios anymore. That was 25 years ago in school, and I'm not certain I did that well at it back then, let alone now.
I always tell people like if they come in because I get the like look at this recipe and tell me if it's okay for me to make this home cooked recipe for my dog, my
Yeah,
cat, or whatever it is. And I always tell them I'm like, listen, I have seen the nutritionist spreadsheets and they are long and detailed, and I don't know what's on them. So I'm not the person who can tell you if this is balanced because I have a full respect for everything that goes into those spreadsheets.
exactly.
Yes. It's always a question mark when we're talking about, foaling, whelping, whatever it is vaccination. I think it's much easier on the small animal side because they have much shorter gestation periods versus you're talking the majority of the year in a mare. So, how does vaccination change for a broodmare?
I mean, it changes a little bit in that there's some specific times for some very specific vaccines that we're going to administer, but really the general principle of the diseases we're protecting the horse from are going to stay very similar to a gelding at that point, right? So we're still trying to protect that mare for those diseases. We just may do it in different ways. Typically, we're using killed vaccines for the vast majority of these administrations in our pregnant mares. But usually, most of our brood mares, when they come in the spring, we'll vaccinate them prior to getting pregnant. So that way they're set up for success. So that would be your core vaccine. So your Eastern, Western tetanus, West Nile, and rabies, and a flu rhino vaccine. So that would be prior to breeding. So that's going to protect them for about the next 6 months or so. And then, really, once the mare gets pregnant, her next series of recommended vaccines or core vaccines would be at months 5, 7, and 9. And this is for equine herpes virus induced abortions. There's two different vaccines that are readily available commercially. Both of them work quite effectively for preventing equine herpes virus induced abortions in our broodmare population. And I think that's a hard thing for clients sometimes to understand. Well, how do they get exposed? Or I have a closed herd of 10 broodmares. I don't need to vaccinate my mares. And the analogy that I always use is cold sores. That's another herpes virus. People are readily available with it. They come out when people are stressed, and sometimes they just come out just randomly. Well, equine herpes virus is very similar. It lives in the trigeminal nerve of the horse, and pregnancy can be a stressful event for some of these mares. So it may not be that you took a horse off the premises to a show and brought equine herpes virus back. It actually is probably on your property already. The vast majority of horses in the United States have been exposed to equine herpes virus at some point in their life. And just like cold sores, one of these horses could spontaneously start shedding on your facility, and that could result in an abortion storm on your property.
Which would be worst case scenario.
Correct.
Yeah, it sounds better to just go ahead and vaccinate.
Correct. And I don't have the graph with me, but I mean, one of the biggest drops in causing abortions was the development of these vaccines in the 1980s. And abortion rates dropped 10 to 15% in the next 2 years and have stayed relatively low since the development of these two vaccines.
Yeah, that is a really powerful argument. I mean, it's not always the easiest thing to breed a mare and then get a healthy foal on the ground. And so, it almost feels like why take any chances there?
Exactly. Right. And I think, everybody's concerned. There's a lot of media going around, and I feel like I get a lot of this up here in the Northwest about, do we really need to be vaccinating these horses? And there's a lot of concerns over vaccines right now. And usually my discussion with the clients is that these vaccines have been around for almost 4 decades. Like, if there was a cause or cause and effect that we would have seen, we would have noted it by now. They're very safe vaccines and should relatively be used regularly in broodmare practice.
Yeah, especially because it sounds like they were developed for this specific reason.
Exactly. At 10 months in full, we're going to vaccinate that mare for her core vaccines again. So Eastern, Western tetanus, rabies, and West Nile, and a flu rhino. For mares, now a lot of those are mosquito-borne diseases, right? So we might be vaccinating this mare in January for a February foaling, which fortunately up here in the Northwest, there's not many mosquitoes. Cassandra, for you down in Florida, you may still have some mosquitoes buzzing around.
Oh, they're our state bird.
There's exactly. So with that, for us up here in the Northwest, we're not necessarily protecting that mare against those diseases right then, what we're doing is boosting her antibody levels in her blood. So when she produces colostrum for that foal in 30 to 40 days when she gives birth, there's high antibody levels in that colostrum to transfer to that foal. And so that way that will protect the foal till it starts receiving its vaccines at 4 to 6 months of age. So that's a little bit of a common misconception of, well, why are we vaccinating this mare now? Well, it's for the foal, not necessarily for the mare.
Right. No, that makes a lot of sense.
And then we get into some risk-based vaccines. We're seeing rotavirus spread across the United States the last couple years. And so we've started introducing that vaccination and trying to get ahead of it. And so we've been waiting for it to show up here in the Northwest. Knock on wood, it hasn't come our way yet as prevalently as it has been in other areas of the country. But I think it's something to consider and having in your arsenal or discussion with your clients of what is our risk for rotavirus in our area, and should we implement this into our vaccine strategy. So another risk-based vaccination is against lepto. So lepto can cause abortions in pregnant mares. And so I think this falls into a risk-based vaccination based on where you are and what is the prevalency of lepto in your area. And I think with all vaccines, I mean, it's just thinking of what's the risk versus rewards. And I think if you're in an area that has minimal to no lepto exposure, you probably don't need to use that vaccine. If you're in an area that has a high prevalency of it, I think it would be very worthwhile searching and utilizing that vaccination during the pregnancy. People always ask, why do these pregnant mares get such a series of vaccines with it, right? A lot of these are 3-shot series during the pregnancy. Well, these are killed vaccines, so they don't cause a big immune response. They cause a very small immune response. So oftentimes with my clients, I have to educate them on that of why is it 5, 7, and 9 months? Because the vaccine only really causes an antibody rise for 30 to 60 days. And so we need to give a second exposure to that vaccination to get a secondary rise in antibodies. So that way we're protected during that entire period. Once you explain that to the clients, I think they get it, but it takes a little bit of encouragement of why are we doing this, and really thinking about what's the pathophysiology of the vaccination and how does it work. And once you explain that, they usually get it quite readily versus a lot of our modified live vaccines. You're protected for 6 months, 12 months at a time.
But you're probably not giving modified live during pregnancy. So yeah, so having to give them more often.
So yeah, it makes intuitive sense once you explain it to the clients of like, look, we're using 2 different vaccines. Yes, it's protecting against the same disease, but this is a killed vaccine versus a modified live vaccine. So it's not going to have as long term of protection.
Right, right. Yeah. And then I think when you take into account the duration of gestation, like it just makes a lot of sense that, like I said, in small animal, we can kind of just wait them out and keep them in a closed off environment. In some cases, you don't really have that option in the mare. So especially when we're talking about some of these, high dollar mares where, we're watching everything and wanting everything to go perfectly. Not that we don't want that for every single situation. Yeah, you want to really cover your bases. And if this is encompassing a large part of her year, then we got to make sure she's protected through the whole thing.
Exactly.
I want to go back to lepto for just a second because, lepto is now a core vaccine for dogs, not for cats. And it's because of just the widespread of lepto cases that we're seeing for various reasons. Has that changed on the equine side at all in terms of, is the lepto vaccine more widespread now, or is it still more pocketed?
How I see it is still more pocketed, right? I mean, it's always debated of, is it a bigger problem than what we're giving it credit for? Maybe we're missing some of these lepto abortions and should be using it more readily, but it still seems to be used in a very pocketed standpoint and very specifically where we see more lepto cases in our equine patients. I think it also depends on the exact facility that we're working with as well, because it's hard to control our dogs when they're running off leash and they may run up to a creek or a lake, and it's hard to tell them to stop drinking. Where with our horse patients, we can put a fence up and prevent them from accessing a lake or a river or something like that with exposure to lepto. So I think it does, there's a wide variety of ways that this could be managed, but I think it's, it's very case dependent right now. And so I see it staying as a risk-based vaccine at this time.
That makes sense. Absolutely. Another area on the small animal side is parasite prevention, because super, super important. But then there's always that debate of like, but what can I give? In my case, it's going to be a pregnant dog. What is the consensus on the equine side when it comes to deworming and parasite prevention?
Yeah, so fortunately, we're quite fortunate that most of our dewormers or all of our dewormers that are approved for the horse are safe for pregnant mares. So while on the box it may say not safe for use in pregnant mares, most of the time, if you reach out to the drug company, they have white papers. They have followed up with thousands of horses that have been pregnant and administered these vaccines and proven them to be quite safe. They just haven't paid for the FDA change to the label to actually say that. And so because of that, that's opened up things quite readily that we can just manage these mares just like the rest of the band of horses, right? So it makes it easier for our clients that they don't have to have a special regime just for the pregnant mares and for everybody else. Now, the only caveat with that is that there is one parasite, Strongyloides westeri. It's kind of a unique little parasite. It lives in the abdominal fat of mares, and the only time it comes out and migrates is when the mare gets close to foaling and around the time of lactation. And it actually travels through the mammary gland, through the milk to the newborn foal. A simple administration of ivermectin on the day of foaling effectively clears that parasite and dramatically reduces parasite loads in our young foals. So it's kind of one that fell out of vogue about 10, 15 years ago. And we kind of thought that that parasite had been eradicated. Some follow-up studies have showed that actually that parasite still is quite prevalent in the horse population. So I think that that theory of continuing to give a dose of ivermectin on the day that the mare foals still should be in place for that specific parasite.
And so it sounds like that's the major change to the deworming protocol, that in general, farms are sticking with whatever protocol they're using up to this point because those can be really unique from farm to farm. But in the pregnant mare specifically, we're giving her ivermectin when she foals.
Correct. And you are absolutely correct that it gets very complex with deworming protocols. I know a lot of farms are really trying to do fecal egg count reductions and finding out their low risk shedders versus their high risk shedding horses. And then those horses are on different yearly parasite prevention programs. And I'm talking about stuff that I somewhat understand, but that's not my forte every day. And so, I think it's been nice that our dewormers are approved safe for use in the pregnant mare, and they don't have to change them based on the data that they've already developed from the fecal egg count reduction tests. That if they're a high shedder, they can stay on that program. If they're a low shedder, they can stay on that program with just one extra added dose of ivermectin.
Simple enough. Simple enough. That makes it much easier. Yeah, lots of parasite conversations happening on the small animal side too. And I'm with you. I very quickly get out of my depth on that one. So yeah, if they have a good, effective protocol, then very helpful. Talking about one of my favorite topics, let's talk about teeth. Another hugely important aspect of equine health, but thinking about dental cleanings, dental work that, involves sedation. And certainly on the small animal side, we see this transient bacteremia. I think they see that in humans too when we do these procedures. So is this one of these where we have to try to fit a dental in a window when she's not pregnant, or is that also safe to continue while she's pregnant?
Yeah, it's a great question, and it's complex in the horse because again, they have that long gestation. Their gestation's 11 months, and then the horse is unique that we can essentially be rebreeding them 7 days after foaling. So essentially, this horse could be pregnant almost year round. And so
Poor thing.
trying,
I'm just kidding. I'm anthropomorphizing there from my own
yeah, no,
experience.
right?
I'm like, oh no.
I completely get that, but trying to schedule a dental in a 7 day period, and you don't even know when the mare's going to foal, right? So we use 340 days as the average, but 330 to 360 is quite normal. So trying to schedule a dental visit around a moving 1 week target is almost impossible.
Sure.
And so Dale Kelly worked with a couple thoroughbred farms and looked back at mares at various stages of pregnancy, a couple hundred mares in each group, and first, mid, and late gestation, and looked at mares that had dentals and those that didn't, and looked at pregnancy loss rates between the groups and showed that there was no difference. So essentially, what this study showed us is that if a horse needs dental care, provided the dental care. And so all of these horses would have been sedated, had routine evaluations followed by their teeth being floated, and didn't show any change or increase in pregnancy loss rates from that procedure. And so I think that's really going to change the way that we can work with these mares and manage them during their gestation, because now it becomes much more a simple of when the rest of the horses on the facility are getting their teeth and getting their dental care taken care of, you can go ahead and have your pregnant mares taken care of as well. And so doing the right thing for the horse, I mean, if we waited for them to not be pregnant, that could be a couple years without dental care. And that's not the right thing for the horse as well.
Right. And, God forbid she were to develop a dental issue during pregnancy. I think that answers a lot of questions as far as, well, what do we do? Where probably previously that was a debate of like, what do we do in this case? Is it safe to sedate her and float her teeth? Or do we have to try to find another way to ride this out? But you make a really good point. Like, okay, so, try to make a plan and ride it out. Then when do you do it? Because then she might, turn around and be pregnant again. So that was probably, I would imagine, a big relief when it came to broodmare management to say if there's a problem or if she needs care, provide the care.
Yeah, well, at least I think a lot of people did it just anyways without
Sure.
hoping that it was the right thing, right? Because from just out of necessity, right? Like
Yeah,
you had no other option. And so, but it definitely opened it up where now we know for sure that this doesn't cause pregnancy loss. And so it's very safe to do. So, yeah, it's the best thing for the horse.
absolutely. Absolutely. Lameness is another, huge topic in equine medicine in general, but these mamas have a lot to carry around. So how do we think about hoof care in broodmares in particular?
Yeah, I think managing their feet and how they get around, I mean, we think about that from a pregnant mare, initially when they first get pregnant, just as we were talking about with the nutrition, that fetus is pretty small. But when we head towards late gestation, she's going to be carrying a couple 100 pounds of extra weight. So making sure conformationally she's set up to support that, but then also that she's getting the routine foot trimming and hoof care that she needs to be successful is very key with that. I think the dental study helped show us that if some of these mares need some sedation to get their feet trimmed, that's okay to do. We'd rather have a mare with a good solid platform to stand on and get around with than negate that waiting for her to full out. And I think the broodmare can be a unique situation as well, because a lot of our top broodmares were high end performance horses, sometimes just 10, 15 years ago. And with those high end performance animals, injuries come up. And so, with that, sometimes we're still managing those later on as a broodmare. Can we make that mare more comfortable? We would, speaking holistically, with a W, as you said earlier, how can we keep that mare comfortable and doing well throughout the entire gestation? I don't want a mare really on bed rest, right? We'd like her to get out and be moving and doing all of those types of things, just like a normal horse would. That's going to help them have a much better pregnancy than those that are just stuck in a stall. And so I think those are all things that we need to manage. And so sometimes that brings in a whole group. I'm fortunate my wife is a sports medicine specialist. And so sometimes we'll just bounce across the aisle and be like, "Hey, can you look at this stifle cuz that's not my forte, and I know it's lame somewhere, and the stifle was the problem a couple years ago in this horse before it became a broodmare." And so we may elect to treat that leg and do some joint injections in that broodmare, which I know sounds a little odd, but it's trying to keep them comfortable during that pregnancy, and gaining that couple 100 pounds of weight during late term pregnancy can be painful for some of these mares if it's not treated well. So I know I mentioned we're jumping straight to joint injections, but sometimes just doing something basic, putting them on pentosan type product, something that's easy that we don't even have to be invasive and put in the joint, can sometimes really help these horses just get through these time periods of late pregnancy and whatnot quite readily as well.
And I may have missed it when we were talking about lameness and joint injections. That sounds very convenient because that is also tends to be my approach to lameness is they're limping somewhere and maybe I can identify it. And I'm always so impressed by sports medicine and rehab specialists where they can just pinpoint like it's muscle, it's joint. It's so impressive. So yeah, that's amazing having that resource. But if we are getting to the point where we need joint injections, you may have mentioned it and I missed it. Did we talk about the timing of the injections? Can you inject her while she's pregnant?
I prefer not to,
Sure.
is my preference, right? Like if we know the mare is lame going into the breeding pen, can we do some things preventatively before we ever get her pregnant? It's relatively unknown the effects of steroids on pregnancy. And other species, steroids are quite bad for pregnancy and can result in pregnancy loss. And so we try to avoid them during pregnancy if we can. Now, sometimes we're faced with situations where I'll pick on another broodmare. She was quite sound when she was initially got pregnant, but then became lame as she gained weight that normal pregnancy. And we do have to intervene, but then that's having a discussion with the client of what's the best thing here for the mare, for the pregnancy. Sometimes there's some risks that may affect the pregnancy, but are the best thing for the horse that we have to take into consideration. So I try to be ahead of those things and treat them prior to the mare ever getting pregnant. And then, I think we're fortunate enough now that we have some joint products that are available to us that we can give systemically to help manage some of these mares and see if that can help get us through the pregnancy a little bit easier without having to do a joint injection per se during the pregnancy.
And that would be like those chondroprotective agents like pentosan or something like that.
Exactly.
Okay, that makes sense. Do you want to talk about long day breeding?
Yeah, it's always a thing to mention, even though it seems relatively common and routine.
Yeah.
Mares are long day breeders. So evolutionarily, they should start cycling around May. But with the imposed breeding date or, all foals are born January 1st, essentially. With that, we need mares to start cycling in February with an 11-month gestation. So they foal in January. So to do that, we just put them under lights. So we make them think it is June and they will start cycling on their own. And so to do that takes 10-foot candles of light. There's multiple apps you can download for free for your phone. And so you can just walk your phone around the stall at the horse's eye level and go, where could this horse put its head? And do I reach 10-foot candles? And as long as I reach 10-foot candles, you have enough light and things will work quite well. We typically start the lights around end of November, early December. Takes 60 days to have an effect. And so they will be cycling in February.
Okay, that makes sense. And is it a certain type of like are we talking like leave the stall lights on, or are these specific lights that they need to be put on the mare?
Just the stall lights. Any
Okay.
LED light out there that provides enough light for 10-foot candles, it works quite well. Be exact, there's a company called Equilume that makes a little mask that you can put on the horse, and it has a little blue light in the right eye that turns on at dusk and turns off at 11 o'clock, which would be the exact same program we would use in our stalls. And that provides enough signal that mare will start cycling, even though it's a blue spectrum of light. And so it's kind of funny to see some of these broodmare farms at night with all the little blue dots running around the pasture and playing and interacting.
Oh gosh. I don't know that I've ever seen that before, but now if I do, now I'll know what I'm looking at. Well, good. Ryan, this has been a great conversation. I've really enjoyed it. I've learned a lot. Thank you for allowing me to draw my comparisons from the small animal side to kind of wrap my head around all the concepts that we were talking about. Any final thoughts you want to leave us with?
I think it's just thinking of these broodmares as year-round animals and realizing that it takes a whole team to support them, right? As a reproductive specialist, I'm heavily involved with these animals for 6 months of the year, but oftentimes they have a GP vet that they go back to and for routine care and whatnot, and just keeping up with them and keeping this horse well cared for year round, that it's not just about making babies from February to July. It's about the care of this horse all throughout the year. And that really sets us up for success during the breeding season.
Yes, hugely important message. And I'm sure the mares are very happy is being put out there to say, there's a lot that goes into this, and certainly sounds like a lot of consideration. So thank you again.
My pleasure. Happy to be here today.
Yay, we had an equine episode. So much fun. Thank you so much, Dr. Ferris, for joining me. Great conversation. A big thank you to Decra for making this episode possible. And thank you, of course, to all of you for tuning in. I hope you enjoyed it. If you did, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. If you want to hear more episodes, you can click on the education tab on the Vetfolio website or find us wherever you get your podcasts. As always, I want to hear your thoughts on this episode as well as ideas for topics you'd like to hear from us in the future. So email me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassie DVM or on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.